Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to all of you joining us here today. We are talking about our up and coming Gold Lactation Online event 2023. There is so much to see and do at this event, and I want you to hurry over to our Gold Lactation website to get in on all the details. It's super easy, goldlactation.com. We actually begin on April 3rd. So that's our opening keynote day. And if you know about Gold Lactation, you will know that all of our keynotes are open access and free. So you can actually register today just for that event. All right. So just know that that is just a gift from us to you. But let me tell you, you're not going to want to miss out on all the details, all the latest clinical and evidence-based information that we have for you this year, and lots more, including our speaker who we have here today, Treasure McGuire. Welcome, Treasure. It's so good to have you here today.
It's lovely to see you again, Fiona.
Well, let me tell you that I got to know Treasure just a little while ago, and her content, her content, Treasure, I have to say, it's going to be mind-blowing. I think it's going to really inform you. I think it's really going to give the tools that you're going to need in order to really, give the evidence to the families. That's what they're looking for. Families just want to be able to make informed decisions. And Treasure, I believe you're the person that's going to do that. But before we talk more about the topic that you're going to be speaking about, why don't you tell folks where you are in the world and what you do?
Okay, so for those that live in the Northern Hemisphere, I don't. I'm winging in from sunny Queensland in Australia, and I live on a little dot next to the ocean called Cleveland or Raby Bay. And if you know anything about Australia, you may have heard of Stradbroke Island. It's the second largest sand island in the world, and it's just across Moreton Bay from where I live. So I guess it's not surprising that we spend a lot of our time boating.
Well, that sounds absolutely delightful. I'm just wanting to Google it right away and see all those beautiful pictures. So Treasure, tell me, what is it that you're doing right now as part of your work process?
Okay, so I'm both a pharmacist, a pharmacologist, and a toxicologist. So kind of drugs are us. And I work as an assistant director of pharmacy, looking after information, education and research in my hospital, but in their wisdom for the last, 26 years and about 16 years respectively, they've on-sold me because I guess the MARTA, the hospital that I work at, is a private Catholic organization, and the Sisters of Mercy are good at doing things like on-selling people. So I do time at both the University of Queensland in the School of Pharmacy, teaching pharmacy students and doing research in that space, and then take off my pharmacist hat, put on my pharmacologist hat for my medical students at Bond University on the Gold Coast.
Wow, so it sounds like your plate is pretty full.
Yeah, it keeps me out of mischief.
That's absolutely fabulous. Well, you may be starting to guess what Treasure is going to be speaking at our conference. And she is, in fact, going to be talking about cannabis use during lactation, evidence-based and parent-centered care. And that's what I love about your topic so much, Treasure, is that you are keeping the parent at the center of the decision-making, which really is primary for those of us that work in this field. We're always talking about keeping the parent at the center. But that hasn't always been the way when it comes to drugs, medication, recreational drugs, and cannabis. And there's some information out out there. There's still a lot of myths about it. There's, non-factual, I should say, information out there. But hopefully through you, because you are the voice here, we're going to be learning all about, the different ways that cannabis does impact the body. And in fact, you are going to take us, and this is just a little bit of an inside scoop, I guess, is that you're going to take us back to the beginning of when a parent would become pregnant, correct?
That's right. You cannot separate pregnancy and breastfeeding. This is a continuum when we're talking about, be it lifestyle drugs or prescribed medication. And the impact of drugs on organogenesis is where a lot of the consumers, women, tend to focus. Will this harm my baby in that permanent congenital anomaly space, whereas there's many medication that may actually be free from congenital anomaly but impact on function. And function is important as the infant grows and gets closer to delivery, to parturition. And there are carryover effects from what we've used during the pregnancy into the postpartum period, particularly for the first couple of weeks postpartum. And so you can't separate the two. And that's even more significant with cannabis because it's a drug that has such a long half-life. And then depending upon the route of administration, everything from smoking to a bong to vaping to what I'm seeing more and more use of medicinal cannabis in our hospital. And also the impact, not just on the woman, it's the people that live in the home with that infant that has a significant role to play, again, based on the route of administration. So I think it's a really important topic for anyone that's caring for women that are breastfeeding to get their head around.
Yeah, absolutely. And when we first started talking about this, I just have such an immense respect for the fact that we're not just going to be dipping our toe into the breastfeeding factor. We're going to look at the whole picture and, in fact, the whole family, which is really, when we're looking at taking any amount of medication, is really important, because those of us that are around us also need to know how to respond and how to care for us and what needs and the conversations that need to be had in order to make a good decision overall. And I think that's it's going to be so important, Treasure. So I really appreciate, the angle and the scope that you're going to provide to us.
Lovely. And I look forward to presenting.
That's awesome. I do have another question for you, and perhaps it's a little bit more personal, but how and why did you start talking about this particular topic?
Why did I get interested in, well, it's not just cannabis. I guess as a pharmacologist, I am much more interested in the fact that we put layers of perception over drugs of different origins as the lay public. For example, women tend to overestimate risk when we're talking about often prescribed medicines, and yet are quite happily going to use complementary medicines because there's this perception that natural is synonymous with safe. Whereas if you come back to basics, unless you have celery growing out of your elbow, it's endogenous to the soil. It is not endogenous to our physiology. And in fact, many of the, and I don't mean this disrespectfully, I work in integrated medicine and I use a lot of complementary medicines. But when it comes to herbs specifically, most of these are very lipophilic substances. And because they're fatty, they like to sit in breast milk more than necessarily the mother's plasma. So we need to look at the safety of those medications, whether they're used for therapeutic purposes or recreational purposes, in the same way we look at any other chemical structure. And so there needs to be equity there. And because we just have this belief that our lifestyle or our complementary medicine use is safe in breastfeeding, and then we've got those nasty other synthetic compounds, I think that myth needs to be dispelled. And that applies to not just the what we might consider the milder recreational drugs, the smoking, the alcohol, but from cannabis right through to the psychedelics. So, it's having that, I guess, clear vision that everything we use, whether it's the food we eat, the bus fumes we breathe in, as we're on the way to work, or the medications or lifestyle drugs we choose to use, there is an impact on our physiology, positive as well as negative.
Right.
And we've got to just look at the risk versus benefit in each case, not go, this is wonderful or this is terrible, and to try and bring that little bit of science into the space of, lactation concerns, I think is a really important place to start from a pharmacology perspective anyway.
Well, I'm just sitting here absorbing all of your words again, and I tell you, I feel like you're such a good translator of the information that I need. By far, no expertise here in pharmacology, but wanting to know and understand in terms that I can then provide, to my clients is going to be of great value to me. So thank you for being the interpreter here and helping us on our journey. And I'll look forward to having you here as part of our live presentations here at GOLD Lactation. So again, Treasure McGuire is going to be here talking about cannabis use during lactation, evidence-based and parent-centered care. Thank you so much, Treasure, for being here with me today. It's been so great chatting with you.
Lovely to talk to you as well.
And thank you to all of our viewers. Once again, if you've got questions for Treasure or any of our other presenters, don't forget to join us for the live event. It opens up on April 3rd. Of course, all of our sessions are going to be recorded for your convenience, but you're not going to want to miss out on any of the live events in order to engage and be part of the larger community here at GOLD Lactation. Thank you again for joining us here today, and I'll look forward to seeing you all very soon. Bye-bye for now.